Hello everybody, is anybody live? Is anybody there? Can you give me a thumbs up? हेलो विजिबल है? चेक करो। एक सेकंड, फिर बैक जाना पड़ेगा इसके लिए। हाँ हाय, ठीक है, ओके थैंक्स, बाय। Hello everybody, good evening. I'm hoping to see some more familiar faces so that I can start with today's session. Hi Geeta. Today I'm here to talk about dentistry during COVID times. I am Dr. Dimple Ajwani from Dr. Ajwani's Dental Center, Koregaon Park, Pune. I specialize in full mouth rehabilitation, smile designing, just making your smile just beautiful. Okay, I practice with my husband, Dr. Himanshu Ajwani, who's an implant specialist. To know more, you can go through our website www.drajwanis.com. Okay, now coming to the main topic of today. Dentistry during COVID times. First, let me talk about how you should maintain your dental health. Anybody here knows exactly what are the steps exactly that we should follow to maintain our dental health? I'll tell you in brief. Firstly, flossing. Secondly, brushing. And thirdly, having a good mouthwash. This minimum has to be done twice in a day. Okay? Flossing, very important in the night. Even if you floss once in a day, that is very perfect. But you have to floss at least once. Let me show you the different type of flosses that we use regularly. Trust me, something like this. It's like a thread, very difficult to do. Trust me, it's very difficult. Even I'm a dentist, but for me also to floss my teeth with this is very difficult. I'll just show you some easier options, okay, how to floss your teeth. A box like this, Unifloss, with a toothpick kind of thing, with a floss in between. Very easy to floss. Just go in between your teeth and everything comes out. The other one which I would like to show is a water flosser. Water comes through it through three pressures: low, medium and high. Medium is the right speed what you keep, and you clean all the areas between your teeth. Okay. Now the brushing technique. There are 2 or 3 types. I could say that you can use an automatic toothbrush or you can use a manual toothbrush. Something like this. Okay. And after that, all of you all should use a mouthwash. Any company you like. I am not here to propagate any company that please use this company. Any company you like, please go ahead, use them. So I repeat, the sequence should be: first, floss your teeth, remove all the tartar from between, then brush your teeth properly, thoroughly, and after that you do your mouthwash. Okay, this is the normal regime that we follow during normal times and COVID times. But now I'm going to tell you how to follow your healthcare regime, that is your dental regime, during the COVID times. We know that the mouth has a lot of microorganisms. So I always suggest everybody to keep the oral aids separate, like the toothbrush, the tongue cleaner, the flossers. Everything should be separate. It should not be mixed with anybody of your home, right? Even with your husband or with your kids. Okay, it should be kept separately. After that, after you use all of these things like a toothbrush or a tongue cleaner or a floss or anything, please dip it for some time in the antiseptic solution. You can even use a mouthwash for that matter. Okay, Do not just wash it with water and just put it aside. No, the microorganisms are still there, the viruses are still there. So trust me, the best thing is to dip it in the mouthwash and keep it aside. Okay? And after that, wash it and dry it. It should be absolutely dry. Okay? The next step, which is very, very important, is after you are done with COVID, means after you turn negative, okay, your report shows that you are negative, please change your oral health. 8 things like a toothbrush and your tongue cleaner. It is very important. Like a floss and all that, all are disposable stuffs that we use. We do not reuse those stuff. Please throw it. Do not use it, because there are chances that the viruses can be stuck in some or the other nook and corner, which will not only infect you but it would infect the others also. All the brushes are together in the bathroom, right? So you have to be very careful. Okay, so any questions on this? Hello everybody. Any questions on this topic? You can please write it in the comment section. I will be happy to answer all your questions. Okay. The next topic I would like to talk about is which dentist should one visit. Okay. What exactly is the right thing? The choice. How would I choose that which dentist is the right one to visit during the COVID times? Trust me, dentistry at this time is very unsafe. You have to visit the right dentist who takes care of proper sterilization protocol. It is very important during this time. The mouth is the place where all the infection spreads. You all know we wear the mask full time. So it is very important to choose your right dentist. Okay, what all should you think that it is right to check before you book an appointment with your dentist? First of all, the clinic should be compliant, COVID compliant. What do you mean by COVID compliant is when you enter the clinic, okay, they will first check your temperature and they will even check your oxygen saturation. You will find all the staff with proper mouth mask and coveralls, means the PPE kits. All the clinic would be empty and sterilized. You're in Dr. Ajwani's dental center. We don't even overlap appointments, in the sense like we only have 5 appointments in a particular day, plus every appointment has to be at a gap of 5 minutes minimum to half an hour, depending upon how you would like to keep it, but we keep it at minimum of 30 minutes. Okay, the entire clinic should be fumigated by the doctor and the staff. Okay, and all the surfaces should be cleaned by chemicals. Okay, now you ask me that how would you come to know sitting at home, like exactly has to, how is the doctor really maintaining all these stuff? Does the doctor really have HEPA filters which kills the virus? How would I come to know if I sit at home and just look through over Google? Trust me, the best thing is when you call up the dental clinic. These people should really ask you that have you traveled outside? Do you have any medical history, or have you had COVID in the past? You can even if they don't ask those questions to you, you can even ask the staff as to simple questions like how many appointments does the doctor take during the day? If you find that there are more than 5 to 6 appointments, trust me, it's very difficult maintaining those hygiene. So this will give you a complete idea, okay, as to is that the right doctor. And once you enter the clinic, trust me, your eyes and your aura will give you the complete satisfaction as to yes, this is the right place we have to visit. Okay, so my next question is as to when we travel to a dentist, what all should we do? Okay, not only a dentist, I would say any medical profession, like for example you want to go to a doctor, okay, and what all precautions should you take while visiting a doctor? Okay, firstly, when you move out of your house, before you move out of your house, please wear double mask. Okay, double mask is mandatory right now. If you are traveling with a two-wheeler or through Ola, Uber, not with your own vehicles, it is even advisable to wear a protective eyewear. Okay. After that, when you travel, when you are just about to enter any practice, any doctor's clinic, it is advisable to please sanitize your hands. Okay, you have come from outside, you're going to touch unintentionally any surfaces. It is better that you sanitize your hands completely. Once you enter the clinic, any staff, be it any medical professional, they do the basic checkups, that is checking your temperature and checking your oxygen saturation. Okay, get those things checked. Make sure that you do not talk to any clinical staff member without a mask. They should be masked. These people are at the highest risk, so the mask is mandatory. Please do not talk to anybody without a mask. Okay, even when you sit, please make sure that the waiting area is clean, and if there are a lot of patients, please maintain social distancing. Please sit apart. Do not stick to each other and sit. It is very dangerous to sit like that. Okay, then I would say, once you enter the clinic and once you do the regular formalities, the doctor or the staff would shift you to another cubicle where the treatment has to be done, like for checkup or anything. So in that case, I would suggest, please keep your sanitizer handy, or use the sanitizer which is there in the clinic, so that even if you unintentionally touch any surface of any clinics, you sanitize your hands immediately. Now, if you ask me, like dentists, like the big dentists, or you could say the dentists who have a big setup, have a number of dental chairs. Like we have 3 cubicles, like 3 dental units. Okay, so it is something like, if you enter one dental unit, please do not roam about in the others, because you are not sure as to that area is completely sterilized, whether it is fogged or the surfaces are chemically cleaned. Okay, do not touch your hands anywhere on any surfaces. It is very dangerous at this position. Even if you want to be more safe, use normal gloves. Okay, this will help you to prevent the infection to get onto your hands. Okay, now next step, once your treatment is done, everything is done perfect, you are happy with the treatment, all the procedure on, please do not get up from the dental chair without a mask on again. We actually forget that COVID is still on. We don't know which patient came to our waiting area. As I have a 3-chair practice, there are chances that my husband has taken another patient to another cubicle and he is working on it. Are you sure that it is completely clean? And it is, when you are entering outside, that time it is very important. Once you get up from your dental chair or from any operatory of any doctor, please wear your mouth mask. Very important. Okay, now you come back to the reception, well and good, but in the clinic, whenever you are getting treated, please make sure that you see how well the staff is maintaining the sterilization. Okay, see if there are HEPA filters which help to eliminate virus. Very important. Staff is wearing PPE kits. Very important. Staff is masked, doctor is masked, doctor is wearing a PPE kit or even a protective wear, well and good. Very important. We cannot compromise on anything at this period. Okay, make sure that you do not carry any food stuff to any dental clinic or medical clinic, because unintentionally you put your hand here, there, and directly you're eating the food. Very unsafe. Try to carry your own water bottles when you go to any clinic, or make sure that the clinic serves RO water or Bisleri water. We serve Bisleri water. Better to be safe than to be sorry. Okay. So this is what I would say, that the important tips that we should maintain when we go to any clinic at all, be it dental clinic, medical clinic, Ayurvedic, homeopathy, any damn clinic. Okay. Next question, which I would like to talk about. People say dentistry is very expensive. Doctor takes a lot of money. She's very expensive. Trust me, dentistry is not expensive. Neglect is. I have patients who have worrying to come to a dentist in the past 1.5 to 2 years. Trust me, they called me up, said, Dimple, I'm really very scared. You think it is the right time to go to a dental office? COVID is spread really so much. I'm so scared. Trust me, this is the right time. I believe a stitch in time saves 9. If you get a treatment done at the initial stages, trust me, you do not have to spend a lot of money on dental treatments, and you do not waste a lot of money on it, and even you destroy all the teeth. Trust me on that. For example, if you come to me, like you come to me with a small cavity, I would rather like to do a normal composite restoration and fill it up immediately, rather than if you wait for 6 months, 8 months, these cavities will go deeper. Then we'll have to do a root canal. Once you do a root canal, you have to have a crown mandatory. Trust me, if you still want to wait for 6-8 months to a year, depending upon how bad the decay is, we'll have to extract it. Extraction means you are putting a bridge, that is a 3-unit bridge, taking the support of the next teeth, or you're putting implants, that is titanium screws into the bone and rehabilitating, or even putting dentures. Trust me, if I am paying 10 rupees for a normal filling, I am increasing the amount to 100 rupees when I am doing implants, or if I am doing bridges, or I am doing dentures. Trust me, dentistry is not expensive, but your neglect is. Please get regular checkups done every 6 months to a year as your dentist prescribed, so that whatever decay, because the doctors, all the good doctors, like for every patient we take x-rays, we do hygiene every 6 months, we take intraoral photographs, which gives us an idea as to what is the progression of the decay, if there is anything. Okay, so I suggest do it every 6 months, 1 year, depending upon every patient is different. The doctors would suggest the right thing to every patient. Okay, they are the right judges. They will exactly tell you as to what is the right treatment for you all. Please get it done. Do not sit at home on the name of COVID. Go to COVID friendly clinics, go to COVID friendly dental clinics, medical clinics. Do not delay your treatments. At the end of it, if you do so, you would increase your bills. Okay, I know many people are affording, they can afford all the bills, no two thoughts about it. But trust me, a natural tooth is a natural tooth, and an artificial tooth is an artificial tooth. Nothing can replace a natural tooth in your mouth. Okay, all the doctors would say that it mimics, but never like a natural tooth. Okay, please take care of that part of it. Okay, so I would say, like, there are a lot of people right now who come to me ki doctor, is COVID time the right time to do any dental treatment? Trust me, like for me, I am very happy to do dental treatments at this time, because my workload is actually less during the normal times, so I can devote more amount of time to every patient. So now, as we cannot have other patients in the clinic during this time, we book slots for them and we do treatment. Plus, we actually specialize in full mouth rehabilitations and geriatric dentistry, smile designing for all the models. So this is the right time to get your smile done. Trust me, because you're wearing a mask. Even if the treatment lasts for around 15 days to a month, nobody would really come to know that you have done dental treatment at this particular time. Okay, so this is the right time when nobody sees your teeth and you're not parting anymore, so you can really get your dental treatment done. Anybody has any questions? I think I'm last 4 minutes to my session. You would like to ask me any questions about anything? I'm happy to answer any of the questions. Hi Geeta, hi Anjali, hi Sonali, hi Sheetal, hi Reshma Kayani, hi Anjali, hi Sonal, hi Sheetal, hi Pallavi, hi Reena, hi Bobby ji, hi Shalu, hi Pallavi. Anybody has any questions which you would like to ask me as a doctor? Trust me, I am happy to help. Even my WhatsApp numbers are there. You can post me any questions. I would be happy to answer here. All your questions, all your worries. Even if you want to do an online consultation with any dental problems, any dental pains you have, any discomforts, you want to go towards smile designing. Like for example, we do smile designing for a lot of models of Femina. We were the official dentist for Femina. Last year we did Citadel Miss India for almost 4 or 5 years. We do constant such smile designing for all the models. With that we also do full mouth rehabilitations for my old people, that is the geriatric patients. So we are happy to help any age group. Okay, it's not me alone practicing. We have a team of doctors who come, see and do their specific cases. Okay. Hi Rupa, sorry I didn't say a hi to you. I missed it, sorry. Okay. So if you want to discuss anything about your smile, you have any questions about COVID, okay, please get in touch with me. I would be happy to answer all your questions. Okay. And right now with COVID patients, please take care of black fungus, that is mucormycosis, which we all know which is going on right now. Okay. Simple tips, 3 or 4 tips I would like to share before I end my video is: first, maintain good hygiene. Okay. Which people get this mucormycosis is people who are on oxygen support for a long time, on ventilators, and immunocompromised people. Okay. So I suggest all those people to maintain good oral hygiene. Even if they can't do it, I think the nurses or somebody to help it can help those people, should do it. Okay. At least brush and even clean your tongue at least twice in a day. Okay. Immunocompromised patients, please use regular mouthwashes after every meal that you have. Trust me, any bacteria, any microorganism in the mouth, you do not know how it multiplies. Especially the people with steroids, because the main treatment now for this COVID-19 is steroids. With the steroids that we take, you know, there is an increase in the blood sugar level in our body. Okay, many people who are not diabetics get diabetic, trust me, for that particular period of time. So immunity of the body is very low. Oral hygiene maintenance is very important during that time. Do not ignore this important fact, because I believe in a stitch in time save 9. Okay. If you do not do it properly, you might get this black fungus, and this black fungus is very deadly. Trust me, the only solution to this is no medication, only surgery, and you lose that much part of your bone, eye, to if it goes to the brain, it is the worst. Trust me. So please, all of you all, take proper care. Okay. Anybody has any questions, or I should sign off for today? I think everybody is happy with my talk and they have no questions. Perfect. Thank you very much, Geeta and Bobby G, for making me a part of VNWC and giving me this platform to share my knowledge with all of you all. Bye bye. See you. Have a great day. Please stay home. Please stay safe. Do not go loitering and do not go for drives just for the heck of it. Okay. I know everybody needs a change, but it is important to be safe at that time. But at the same time, do not ignore your dental problems. Trust me, if you ignore it for a long time, you are increasing your cost of the treatment, and you might lose your tooth. Okay, see you, bye bye.